So as you already introduced, I'm CEO of GZA Hospitals and the president of the network hospitals GZA and ZNA, which is a big hospital group in the area of Antwerp. And we have over 3,500 beds and, for example, more than 8,500 deliveries. We're not doing deliveries by drones, I think, in the future, but just to give a little bit of scale. And as to emergencies, we're speaking about more than 170,000 emergency consultations a year, which is an important scale to operate and to have transport or fast interventions. And maybe that's also interesting. So we are located on 17 sites, hospital sites, but also outpatient clinics. And we are nicely surrounded by a lot of traffic roads and a lot of traffic jams, as you see in red. So it's a big challenge to go from one place to the other. And of course, we hope that the COVID times would have released us a little bit with this issue. But nowadays, I think it's ever... It's really busy on the roads, though everybody seems to work at home, but I don't know where they are. So traffic is challenging and will be challenging still in the future, especially if you give medical care. So we participated, our doctors participated on a research study with the transport of samples by drones. And we had 6 volunteers who volunteered to give their blood, of course. And we transported that samples in drones with 36 flights. And we compared them with same blood samples on the ground. So that's the setup. And it's, of course, important to know what's happening with the samples because we have to need them in a diagnostic setting. And there were 36 flights. They took 30 minutes, equivalent to 30 kilometers. And it were not quiet flights, up, down, rolling, just to see what's happening with the blood. And we noticed, and that's really important, that there was no significant change in the integrity of the samples. No effect on blood grouping, no effect on some PCR tests, no hemolytical effects, and little effects on some biochemical parameters. But all in all, it's really promising to see that when you do this transport by drones, it doesn't affect, or in this first study, affect your integrity of your blood sample, and that's really important for good diagnostics to do. So it's a promising start, and also a test which we could experience ourselves. I think that's really important that hospitals are engaged in the setup of those things, not only because they're experienced, but also to check if drones can be a solution in our problematic life of transport and fast diagnosis. So that makes, of my belief, and I think more belief, that drones will be a really important feature in the future for healthcare, in our healthcare ecosystems. And I see 2 big ways. First of all, the more acute things. We are in a dense city, and everything can happen. We know that the world we live in is not a simple world. So as to disaster management, it's also very important to have drones to check the area before medical supplies or medical support is coming in. I think that's one of the first, maybe easy way of using drones in helping us to detect main areas of disaster planning or accidents. Otherwise, we're also here in the harbor. It is also an easy way of using telecommunication with problems in the harbor or on ships, and then at the same time sending medical supplies to ships. I think that are small, little, but really important features for the future. And of course, transport of blood is important, organs. But at the same time, that's more in an acute operational setting. But it's also important to use drones in a more structural way to transport your medical supplies. But then we're speaking about more big weights.
Yeah.
And then we need more medical cargo drones. And they have to be more structured and integrated in your operational work as a hospital. So that's an important other way of thinking. We saw a drone for personal a personal drone where you can put a doctor in maybe to go to the harbor or to another place, or a patient. But it would be easier to put in a healthcare worker in a drone to overcome distance and to be fast. I think it's really promising. We need to tackle a lot of things like cost. We'll go further on it in the debate, but I think it's promising, and I hope the further development will go on and help us in this development in healthcare.
Thank you very much.